Hello, I'm Dr. Michael Perlstein. I'm a board-certified podiatrist and have treated over 25,000 patients in the last 20 years. And one of the most common problems that I see and treat in my office is the diabetic foot problem. Whether it comes from an injury or whether it comes from their particular disease, I can help evaluate and properly treat these problems. The diabetic patient requires a very special examination. It's a very thorough exam that we do. We examine the way they're walking, we examine the way they're standing, we examine their shoes, we examine their lifestyle, what they do, what type of work they do. We test their nerves to see if it's working properly so that they have normal feeling. We test their circulation by using some of the machinery that we discussed before, such as the arterial ultrasound, the pulse volume recording, or even the laser Doppler. This is all used as a standard evaluation for the diabetic population, which has been known to have one of two problems. Either neuropathy, where they don't feel their foot properly, lending them to injure themselves, cutting it, stubbing it, hurting themselves, developing infections they don't see, or developing ulcers or gangrene in the foot that does not have enough blood flow. All of these things can be evaluated properly in our office, and the special treatments that we offer are something what I think is really wonderful. The Circulator boot is just something very wonderful. It's non-invasive, there's no surgery, and people who have other medical problems such as strokes or circulatory problems from diabetes can be helped with this particular machine. What it is a boot that we apply to the legs, and again, it does not hurt. The person sits with their leg in this particular boot, the pump is applied, it is connected to the heart with a little sensor. And what that does is that every time the heart gives a stimulation, the boot takes a message to start to work, and it gives a pump along with the heart, so it actually helps the heart push blood into the foot, into the toes, and therefore if the patient has problems, we can create new blood vessels. If they have wounds that haven't been healing, we could actually pump fresh blood and oxygen and allowing these wounds to heal very nicely. We know that there are certain wounds that have difficulty in healing, and through studying them we realize now that there are basically three problems that are happening with these particular wounds. One is that there's a type of infection that's called a biofilm that develops around the bacteria, which does not let normal antibiotics work, and therefore that is stopping the wound from healing. Along with that, we don't have enough blood supply getting into the area. And we also have a layer of dead tissue which is not letting the wound heal, it's not letting normal cells come into the area, it's not letting a blood supply get into the area, and it's not letting anything get there. And some of these wounds just take a tremendous amount of time to heal. So what we realize now is that these things can be healed with a new type of therapy that we call the MIST therapy. And I'm actually proud to be the first one in New York to introduce this type of therapy. And what it consists of is a new type of ultrasound which uses a water vapor which is produced by the machine, and it actually doesn't even touch the person as far as giving the person any pain. So in very sensitive wounds, this is a great way of treating this particular problem. And what this machine does, it cleans away some of the dead tissue. It actually stimulates some of the cells that are not working properly to wake up and actually start doing their job of producing more cells to heal the wound. It actually stimulates new blood vessels to form underneath the wound. And after just a couple of treatments, we can see a dry, dead wound suddenly become alive. The infection is gone, new blood cells are forming, and we could actually speed up the wound healing process, sometimes between 50 and 75% in wounds that otherwise just did not heal. And we had this recent patient that came into our office that after 8 months of being hospitalized, getting intravenous antibiotics, being diagnosed with all sorts of different problems, and it was actually told that he may need his toe amputated, came into our office where we examined the wound properly. We used our new technology. We used our non-invasive vascular testing consisting of the skin perfusion testing with our laser Doppler, evaluating him with our pulse volume recording, as well as actually taking digital x-rays. We realized that this person was improperly managed because he was not properly diagnosed. With our diagnosis and with the proper treatment including some of the newer treatments such as the mist therapy, which actually stimulated the wound to heal with the proper shoe gear that we designed to offload it or get pressure off that area. The patient had several treatments, all of them not painful, all of them done in our office with our equipment. And after 3 weeks, as you can see, this wound closed up very nicely, preventing an amputation and letting this person get back into a normal shoe with a normal lifestyle. And he was incredibly grateful.
I'm an 84-year-old diabetic, and I've gotten such good care here, and Dr. Perlstein has saved my toe. He's doing it for the second time, and it's good not to think in terms of immediately removing something just because it has an infection in it. And we sing his praises because he takes time and patience and has a deep understanding of the healing methods. So we're very grateful. I am very grateful. My daughter is very grateful.
And very cutting edge.
Yes.
And you really can tell that he cares and really delights in getting people better quickly with the least amount of pain and complication.
Many people with diabetes are at risk of developing wounds on their feet that just won't heal. They're also at risk of getting hardened arteries in their legs, a condition that can be very painful. These issues are what cause some diabetics and some people with peripheral arterial disease to need amputations. But doctors at Mayo Clinic are using a special boot to help prevent amputations and save limbs. It's called a Circulator boot. John Bergman wears it 5 mornings a week.
It feels good, almost like a massage, in fact.
John has poor blood supply in his legs, and because of that, a wound developed that just wouldn't heal. It started small, but without enough nutrient-rich blood flowing to it, the wound got worse.
At one point, it was about 13 inches long and 9 inches across.
Blood supply is the most important thing for wound healing.
Dr. Karen Andrews says if wounds can't heal, they can get infected, and this process could lead to an amputation. But the Circulator boot is helping to save limbs.
And we actually studied it and found that we were getting good results. We were saving limbs. We were healing wounds that had been present for months.
Here's how it works. Every time your heart rests between beats, the Circulator boot fills with air and compresses the leg. This sends nutrient-rich blood through the arteries toward the foot, helping wounds heal. The compressions also push blood through clogged arteries and help form new pathways for blood to circulate. Then it brings blood back to the heart to be oxygenated again. It's working for John.
Today, the wound is down to where it's, about like an egg, about that big.
And John's able to walk through life knowing his leg is healing. Dr. Andrews says the Circulator boot may not be right for everyone. People with blood clots in their legs or people with certain levels of heart failure should not use it. But for many people, the Circulator boot may help avoid an amputation. Dr. Andrews also wants to let people know that if a leg cannot be saved, people can do very well with amputations. Surgeries are state-of-the-art, as is the development of prosthetic devices. Now keep in mind that not all types of leg compression devices are designed for these problems, and some can make things worse. So before you start any compression therapy, talk to a doctor. For Medical Edge, I'm Vivian Williams.